Homabay County has no single health facility capable of handling the coronavirus situation. This is the state of affairs in several other counties across Kenya. Further, despite bordering Lake Victoria, the residents of Homabay County lack water for the most basic of needs. No water for private or domestic use, and no water for public use or for use in public places, such as markets, supermarkets, schools, and places of worship. This, of course, is the situation in most parts of the country. Seeing what has happened to countries with better public health and sanitation services, and with better access to clean water services like Italy, it is a matter of time before Homabay County, with its high HIV prevalence, comes under the heaviest coronavirus infection. This will be so unless the ministry in charge quickly intervene and establish health facilities to quarantine and treat those who will be diagnosed with coronavirus, and ensure access to clean water and soap in public places, including markets and places of worship, while making more accessible ARV and immunity boosters for those infected with HIV/AIDS. I also request strict implementation of the measures so far put forth by the government to control the epidemic, and strict punishment for breaches thereof. In particular, all learning institutions should be closed. All places of worship should be closed. And I'm saying up to now, as a leader, I'm getting invitation to attend worship at either mosques or churches in my constituency and in other neighboring places around Homabay town constituency, coming weekend and going forward. I wanted to request our clergy and religious leaders that this is good for the nation. Worship has been reduced because of overcrowding to places including the Vatican, to places including Medina, Mecca, and those other places. I think it is selfish and it is not right that our religious institutions are still insisting on being open to people to worship, knowing the overcrowding that will be there. They should be closed until further directions from the government. Additional measures, including that all night clubs and entertainment joints should be closed, should be put in place. All sports activities should stand suspended. And I'm saying, I know Bunge FC was supposed to be traveling to Turkey to play Hungary, Romania, and Turkey on an international tournament we've been engaging in each year. We advocated, and I'm pleased to confirm that the leadership of Parliament has cancelled our participation in that event. You know the situation in Europe, including Turkey, as we speak. Government should consider banning open-air markets. You know where we have the Aswekra people. You go to Homabay today, there are 4 big open-air markets, very overcrowded, with barely no space between people. No water as you enter the markets, no shop, no sanitizers. I'm saying before we are hit, and this is going to be a matter of time, not weather, let us, get a way of either closing those overcrowded open-air markets to prevent it. Better measures and regulations are required around public transport. And this public transport includes Kenya ferry services, Kenya railways, public service vehicles, I'm talking about the matatus, and air travel services. You need to see the situation at Likoni Ferry. You need to see the overcrowding in the trains, the SGR trains and other trains. You need to see the 14-seater matatus or other public service vehicles to realize that we are sitting in danger. When you are being told that there should be at least a meter distance, you may be doing sanitization as you enter the matatu. But what of those who could be infected already, coughing or sneezing in those matatus? What would be their impact? if we continue. So I'm talking about better regulations and measures. It may be harmful to our economy in the long run, but the number of people matatus can carry should be reviewed, and the measures around the control of this thing should be reviewed immediately, just as we did with the Michuki rule. There's a sacrifice. It is better, in my view, than waiting for us to have a complete shutdown in those businesses and shutdown, lockdown in our cities and towns. Screening and diagnostic services should be made free and more accessible. So far, the people who are being screened and the people being taken through diagnosis are people who are suspected. I want to believe that with human mobility, the numbers who could be infected in Kenya are far beyond what we are being treated to. And I want to tell Kenyans, if you've looked at what is happening across the countries of the world, it starts with some one person identified, it goes to some 2-3 people, there will be a struggle to reach 10, then it explodes to thousands. I'm requesting that the government takes measures to ensure we have proper diagnostic facilities, not just in Nairobi, but across, because even the people in Nairobi are traveling, back to the rural areas. I'm just from my county, Homabay. I passed through Eldoret, I was in Bungoma, I was in Nakuru. If I were infected, you can imagine that thing has, passed through all those places in some way. So we should deal with that. More medical personnel should be recruited and trained. What I'm being told from the friends I made in Italy before I left Rome is that people are largely dying because there is a strained in number of personnel and human resources. They cannot treat so many because this thing comes as an epidemic. So many people are hit, so many people need treatment at the same time. So what is happening is that the doctors, the medics decide who lives and who dies based on who they sacrifice to treat. Before we reach the crisis or a situation where we have those big numbers to deal with, because this thing is with us, let us recruit doctors. Let us